afternoon session. Now, I would like to invite Dr. Janit Varnasekara, Head of the Community Medicine Department, to deliver the welcome speech.
Good afternoon, ladies and gentlemen. Here we are going to commence the second part of the 6th Undergraduate Research Symposium of Faculty of Medicine and Allied Sciences, Rajaratnam University of Sri Lanka. As the head of the Department of Community Medicine, as well as the coordinating department of Research in Medicine module for our undergraduates. It's a glad moment because here we are commencing the second component of 6th Undergraduate Research Symposium. My duty here is to welcome you all. Because of that, I'm not going to talk much. I would like to welcome the Dean of Faculty of Medicine and Allied Sciences, Rajaratnam University of Sri Lanka, Dr. Janaka Pushpakumara, who is a key person behind the success of research projects of Faculty of Medicine as well as the success of this research symposium today. I would like to welcome all the panel of experts who are joining online today with us, who have dedicated their valuable time for our undergraduates. I would like to welcome for the second time Dr. Damitha Gunawardana, who has joined even in the morning session as well. Thank you very much. And also Dr. Dushanti Jayawardana, Dr. Santusha Fernando, Dr. Yasasvi Valpita, Professor Veranja Lianapathirana. Thank you very much for expending your valuable time on behalf of the benefit of our undergraduates. I would like to welcome all the academic staff members of Faculty of Medicine and Allied Sciences. During last 1.5 year period, they have been supervising our students and guiding our students to complete these research projects successfully. I welcome you all and thank you very much. I would like to welcome all the non-academic staff members who have been supporting the research process of Faculty of Medicine and Allied Sciences, Rajaratnam University of Sri Lanka. At last but not least, I would like to welcome all my dear students who are here as students today, but they will be contributing to the field of science as experts of different fields one day. I welcome you all and I hope that you will enjoy the second part of the 6th Undergraduate Research Symposium of Faculty of Medicine and Allied Sciences, Rajaratnam University of Sri Lanka. Thank you.
Thank you, sir. Now, we will listen to a special message by Dr. Janaka Pushpakumara, Dean of the Faculty of Medicine and Allied Sciences, Rajaratnam University of Sri Lanka.
Esteemed evaluators, faculty members, supervisors, and our aspiring young researchers. It is with immense pride and great pleasure that I stand before you today at the Student Research Symposium of the Faculty of Medicine and Allied Sciences, Rajaratnam University of Sri Lanka. Today marks a significant milestone in the academic journey of our 2018-19 batch medical students, as they present the culmination of months and sometimes years of hard work, dedication, and scientific inquiry. The inclusion of 8-credit research component in our MBBS curriculum is not just a requirement. It is a vital part of shaping well-rounded medical professionals. This component provides our students with the opportunity to develop essential skills beyond the clinical practice. It enables them to critically evaluate scientific evidence, adopt methodological approach to problem solving, and contribute to ever-expanding body of medical knowledge. In an era where evidence-based practice is the cornerstone of quality healthcare, the ability to understand, conduct, and apply research finding is indispensable for any competent medical practitioner. Our aim is to cultivate a research culture that goes beyond the classroom, inspiring our students to continue pursuing scientific inquiry throughout their careers. The skills they gain through this research component, critical thinking, data analysis, and scientific communication, will not only prepare them for better doctors, but also equip them to be leaders in healthcare innovation and policy. Today, we acknowledge the tremendous effort of Department of Community Medicine, which has tirelessly coordinated this research component and guided our students throughout the process. Your dedication has been pivotal in creating a supportive environment that fosters scientific curiosity and excellence. We also extend our deepest gratitude to the academic staff who have served as supervisors, providing mentorship and expertise. Your commitment to nurturing the next generation of medical professionals is truly commendable. A special thank goes to our external evaluators, whose insight and feedback brings an invaluable external perspective to this symposium. Your contributions ensures that our research standards remain rigorous and our students receive well-rounded evaluations of their work. Our students, I say this, you have taken the first step in a lifelong journey of learning and discovery. Embrace the spirit of inquiry. Continue to ask questions and let this experience ignite a passion for research that will stay with you long after you leave these halls. Thank you.
Thank you, sir. To commence the afternoon session of our symposium, I would like to invite Chair of the Undergraduate Research Symposium, Professor Nuwan Wickramasinghe, to address you all.
Thank you very much, Sonali. Thank you very much, Sonali. As in the morning session, it indeed gives me great pleasure to talk to you about a few words at the commencement of this afternoon session of the 6th Undergraduate Research Symposium. I know, first and foremost, I must thank all the expert panel of evaluators who are joining with us today for this afternoon session. I know how busy you all are because some of you have just returned to the country and some of you have been evaluators in the morning session as well, and the others were engaged in other teaching and other academic commitments. So despite all these busy schedules, thank you very much for joining with us today. And also, as I mentioned earlier, this year we have the 6th Undergraduate Research Symposium. We are conducting this as a virtual event for the 4th consecutive year. And this afternoon session will feature 15 research group presentations from the 2018-2019 batch. And we are very happy that our undergraduates have not only presented in our Undergraduate Research Symposia, but also in national as well as international conferences. And some of them have gone on to win some awards as well. So at this juncture, I would like to thank all the academic staff members who have supervised as well as guided our undergraduate researchers, junior budding researchers, because this is their first experience in research. And we expect that this would be a stepping stone for their entire career to carry out fruitful research as medical professionals in the future. Thank you very much.
Thank you, sir. Let me introduce the expert panel who will be evaluating today's presentations. Dr. Damita Gunawardena, Board Certified Specialist in Community Medicine, Senior Lecturer, Department of Community Medicine, Faculty of Medicine, University of Peradeniya. Dr. Dushanti Jayawardena, Board Certified Specialist in Community Medicine, Senior Lecturer, Department of Community Medicine, Faculty of Medicine, University of Colombo. Dr. Santosha Fernando, Board Certified Specialist in Community Medicine, Senior Lecturer, Department of Medical Humanities, Faculty of Medicine, University of Colombo. Dr. Yasasvi Valpita, Board Certified Specialist in Community Medicine, Senior Lecturer, Department of Community Medicine, Faculty of Medicine, University of Colombo. Professor Veranja Lianapathirana, Professor in Microbiology, Department of Microbiology, Faculty of Medicine, University of Peradeniya. Now, we would like to remind a few housekeeping rules for the attendees. Please keep background noise to a minimum. Make sure you mute your microphone when you are not the speaker. The session will be recorded and we will share the live YouTube link in the chat of the Zoom session. Expert panel will ask questions for 3 minutes from all the members of the research group just after broadcasting the respective video presentations.
Recording in progress.
Now, let's commence our first presentation of the afternoon session, the group number 16, and the members are Morapitiya PC, Miranda SK, Madhavatta ND, MACS Nafreen, Nikeshala HCS, Nimesha AS. Over to you.
Do you know why some people die, but some people do not die from the same cancer? That was our question. Actually, that's a multifactorial condition. However, the stage at presentation and the stage at diagnosis plays an important role. A very good afternoon to you. Today, I will be presenting our findings on the association of pap smear screening with stage at diagnosis of cervical cancer patients in Oncology Unit, Teaching Hospital, Anuradhapura in the years 2021 and 2022. Cervical cancer is the second most common cancer among females in Sri Lanka. In Sri Lanka, it is recommended for all women to undergo pap smear screenings at the ages of 35 and 45, which is freely available in public health sector. Even after that, around half of the cases are diagnosed at advanced stages, resulting in death in over 55% of newly diagnosed patients in the same year, despite of the treatment. Our objective was to investigate the relationship between pap smear screening and the stage at diagnosis among cervical cancer patients registered at the Oncology Unit at Teaching Hospital Anuradhapura in the years 2021 and 2022. Therefore, we conducted a cross-sectional study at the Oncology Unit, Teaching Hospital, Anuradhapura, focusing on 103 cervical cancer patients diagnosed between 1st of January 2021 to 31st of December 2022. The data were collected through medical records and telephone interviews and analyzed using the beta version of IBM SPSS, 23. Statistics. From the analysis of data extracted from our medical records, considering the total number of patients, we found out that 81.8 were diagnosed at advanced stages. The mean age at diagnosis was 59.75 years, with postmenopausal bleeding being the most common presenting symptom. From the results of our interviewer-administered questionnaire, we found out that only 37.2 had undergone their first pap smear, and just 7% had a second pap smear. The main reason for not undergoing screening was unawareness, while some were afraid. According to our research, it is evident that lack of screening leads to late-stage diagnosis. Therefore, implementing measures to increase awareness of the National Cervical Cancer Screening Program would be beneficial. Also, we have found out that there is a significant gap between the mean age of diagnosis of cervical cancer and the age of last pap smear offered by the Public Health of Sri Lanka, which is age of 45. Therefore, extending the screening program beyond age 45 could significantly reduce late-stage diagnosis and improve patient outcomes. These are our group members. Thank you.
Now, the presentation is open for the discussion.
Congratulations, nice presentation. Actually, it's a important aspect you have actually studied. My question is, if I ask you to name two most important findings of your studies, what are the findings you will state? Two most important findings of your studies.
When considering the two most important findings of our research, the most important thing as we think is the mean stage of diagnosis of the cancer is about 59.75. It's about 60 years of age. And there is a significant gap between the last pap smear screening and the mean stage at diagnosis. So if we increase the frequency of doing pap smear beyond the age of 45, it would be more beneficial. That is one finding. And the next thing is most people present at the advanced stage of the cancer. That one is the next important finding that we found through our research.
Yes, so so that is the in conclusion, you have mentioned that the frequency has to be increased over 45, but the problem is in your study you have found 3/4 of the patients have not undergone any pap smear screening, right? So they don't have any pap test, and even out of the quarter who had at least one pap screening test, only 7% had the second one. So then what should be your recommendation based on your findings?
Sir, it is in our findings also we have found out that people who got negative for the first pap smear won't attend for the second pap smear because they think that they are negative for the lifetime. So we have the MOH currently does a great job in increasing the awareness about pap smear screening in Sri Lanka. But we think that not only the MOH, but all the hospitals, primary, secondary, tertiary, and especially the general practitioners should use their practices to promote opportunistic health promotion and increase the awareness of the people about pap smear screening. And also we should educate the doctors about cervical carcinoma and the treatment options so that they can teach the patients Also, as the world is becoming digital, we can use SMS text messages for the selected target population to undergo pap smear at the ages of 35 and 45. And also, so we also think that more researchers about this topic should come before this becoming the commonest cancer in Sri Lanka.
Right, okay, thanks, sir. Thank you.
Thank you, sir.
Thank you, sir. Now we will be moving on to the group 17. The group members are Pereira MSS, Nimeshika RMH, Nushha MNF, Pallepola PBMB, Patirage CC, Patiraja PMAP. Over to you.
Good afternoon. There are many units in hospital. Out of those units, give me one example where that directly interact with other units regularly. So, one such unit is radiology. So, let's begin. It's all about radiology. Welcome to the 6th Undergraduate Research Symposium, Faculty of Medicine and Allied Sciences, Rajarata University of Sri Lanka. Our topic is burnout among radiographers and doctors working in radiology units of 5 selected hospitals in Sri Lanka. You may wonder why we have selected this topic. Please pay your attention to this graph. We have found a research which is conducted in China showing burnout related to different subspecialties of health. In there, they have compared burnout among surgery, medicine, anesthesia, pediatrics, and in radiology. Surprisingly, in radiology, they have the highest burnout. There are 2 main objectives in our research. First one is we assess the prevalence of burnout among the healthcare workers of radiology units in Sri Lanka. Not only that, we determine the factors associated with burnout. In our study design, we have selected a hospital-based descriptive cross-sectional study. We conducted our study in a large area covering 5 main hospitals. This include Teaching Hospital Anuradhapura, Teaching Hospital Peradeniya, National Hospital Kandy, Base Hospital Taipei Dambulla, and Teaching Hospital Polonnaruwa. Our study period is last year August to this year February. Study population, as you know, radiographers and doctors working in radiology units. We have chosen an internationally accepted Oldenburg burnout inventory as our data collection tool, which is validated for Sri Lanka. As our total participants, we have taken 64. Among these 64, there were 67% doctors and 33% radiographers. Although we have chosen 64 as our total participants, we have covered more than 90% of total doctors and radiographers in radiology units which we have covered. We categorize burnout into 3: exhaustion, disengagement, and total burnout. Please pay your attention to these 2 graphs. In the left side, you can see doctors. In the right side, you can see radiographers. When comparing these 2 graphs, you can see radiographers, they show a higher burnout compared to doctors. Also, radiographers, they show highest total burnout, exhaustion, and disengagement. What are the factors that affect for the burnout? Is it money? No. It's not true. When we consider doctors having a stressful working environment, inadequate staff, female gender, fear of exposure to radiation has significantly affect for their burnout. Meanwhile, in radiographers, not having a friendly staff, having chronic illnesses have affected for their burnout. We emphasize that for doctors, having a stressful working environment is a significant burnout for them. But in radiographers, it's not the case. They say not having a friendly staff is a burnout for them. So it's up to you to think about that. So finally, there are many factors that affect for the burnout in doctors as well as radiographers in radiology units. But every dark cloud has a silver line because most of these factors can be simply modifiable, which lead to an enjoyable and relaxing working environment. This is our group members. Thank you.
Now the presentation is open for the discussion.
Thank you very much for that very poetic and beautiful presentation. I was so captivated, and what a lovely research you have done. May I ask you, congratulations, wonderful. How did you define burnout?
Yeah.
Burnout is a syndrome of depersonalization, exhaustion that make distance from their working environment, that reduce their working capacity. We define burnout in that manner.
That's right, because you said disengagement and total burnout also. That was also one component. So I was just wondering whether these are two different things or one of the same thing. Okay. So the other thing I wanted to ask you was when they said stressful environment, did you explore into what are the components that make up the stressful environment that you referred to?
Actually, madam, that's a good question. So in that level, so we reduce our scope into this much level because when we started this research, there were so many associated factors. So we reduced our associated factors to this level, I mean, stressful environment, but we couldn't actually statistically confirm what are the factors associated for that. But when we qualitatively assess them, I mean, when we interact in them with interview manner, so we could see the higher workload with that stressful environment cause this problem with this.
Right, I understand. So this questionnaire didn't really explore the components of what is a stressful environment for radiographers and radiologists. That's what you're saying?
Yes, madam. Actually, we have two questionnaires. First one, Oldenburg inventory, and we make another questionnaire, the big questionnaire for them to assess the associated factors. So it didn't mention what are the causes for this problem.
Right, and did your okay, I think we have run out of time. So have we run out of time? I think so. Oh, okay, there's one more minute. Okay, great. So when they said this increased workload, and when you spoke about that, were unnecessary referrals that were perceived as unnecessary referrals a part of this workload, but the radiologists thought were unnecessary? Did your question ask about that? Because a lot of the time this workload is usually defined by radiology departments as unnecessary requests. Was that covered in your questionnaire?
Actually, madam, in that workload, yes, they can manage this workload, but the problem is they are working the working environment now. So not having friendly staff lead them to not manage this workload properly. Because if they are friendly staff, they can manage this very easily.
Right. Thank you very much. Congratulations and well done. I'm very pleased. Thank you. Thank you.
Thank you, madam. Now we will be moving on to the group 18. Group members are Pereira GNU, Nisanka NAACM, Pereira APR, Pereira BHD, Pereira JTK, Pereira PMS. Over to you.
Good afternoon, everyone. Today, I will be presenting our research finding on awareness on non-communicable disease risk factors and preventive practices among 2020-21 academic year undergraduates of Rajarati University of Sri Lanka, a cross-sectional study. We are group number 18, 2018-19 batch, Faculty of Medicine and Allied Sciences, Rajarati University of Sri Lanka. Non-communicable diseases, NCDs, are rising alarmingly in the world. As per recent World Health Organization data, non-communicable diseases account for about 74% of all deaths in worldwide, and 86% of premature deaths in low and middle income countries. Importantly, 25% of the people of 18 to 69 year age category is known to have at least one non-communicable disease. Improving the awareness about non-communicable diseases and practices towards reducing the risk factors among young population is thus pivotal in reducing the morbidity and mortality associated with non-communicable diseases. In this study, we assess the awareness on risk factors of non-communicable diseases and practices towards the disease prevention among group of undergraduates of Rajarati University of Sri Lanka. This study was conducted from August 2023 to December 2023 as a cross-sectional study among 2020-21 academic year undergraduates of Rajarati University of Sri Lanka. For our study, we have recruited 384 undergraduates from all 6 faculties who were volunteered to participate in our study. We use a structured questionnaire consist of 38 questions to assess their awareness and practices on diet, physical activities, smoking and alcohol consumption. The questionnaire was distributed using online platform. In the data analysis, each component was awarded 100 marks and 50 as used as cutoff to identify good knowledge or practice. Data we collected from 389 undergraduates in age range of 21 to 25 years. Majority, about 80% of participants were females. The highest number of response was obtained from medical undergraduates. Average knowledge score of all participants was 25.5. Over 90% of participants had poor knowledge. Highest average score was noted among medical undergraduates, while the lowest was obtained among undergraduates of Faculty of Social Sciences. The average Patrice score was 44.7. Compared to knowledge, practices towards the control and prevention of non-communicable diseases seems to be better in the study cohort, as the poor Patrice was detected only among 62%. Though the knowledge on non-communicable disease risk factors seems to be poor among the undergraduates of Faculty of Social Sciences, they showed the highest average Patrice score. Among the Patrices, 10.17 used to consume healthy food, like yogurt, mixed nut regularly, and others consume unhealthy foods, like potato chips, chocolates, and pastries. So it was identified as the incorrect Patrice among the majority. Further level of physical activity was inadequate among 86.12%. Though the regular consumption of alcohol was detected among 17.73%, the majority, 81.5%, was non-smokers. Further, we identified a significant weak positive correlation between knowledge and Patrice with regards to non-communicable disease risk factors. Most undergraduates aged 21 to 25 had poor knowledge and preventive practices of non-communicable disease risk factors, highlighting the need for programs to improve both knowledge and attitudes towards the healthy lifestyle practices towards the control and prevention of non-communicable diseases. These are our group members. Thank you.
Now the presentation is open for the discussion.
Okay, thank you very much for that very interesting presentation. My first question is, you mentioned that you had a sample size of 300 odd, right? Okay, so how did you get that sample size? Was it calculated, or how did you determine that sample size?
Thank you for the question, madam. We took as a sample of all the 6 faculties of Rajat University. There were about 2,000 students, but we calculated using a formula that 50% of them had a good knowledge and good practice, and that sample size we got is 389.
All right, so it was a calculated sample size. Okay, so what was the sampling method you used? Now, there were 6 faculties and there were several batches in the faculties as well. No? So what was the sampling method you used to collect your sample?
Convenient sampling method to collect the sample.
Right, okay. And now after using the questionnaire, you classify them as having good knowledge, bad, and practices also were classified. So how can you justify you had a cutoff of knowledge and practices? You said you took 50, no, as a cutoff for knowledge, and for practices also you had a cutoff. So what is the justification for using that cutoff? Why did you select 50 in knowledge, and why the cutoff at practices? So how did you decide that that is the place you can divide them as having good and bad?
We had another literature survey. We had a similar research assessing the knowledge of the non-communicable disease in Sri Lanka school children. We were distributing this like questionnaire. They also take as a 50 as their cutoff. So we also decided that 50 is. I would like to add some more, madam. In this our research, we justified some questions. We selected particular questions that show the good knowledge and practice. So we, according to that, we justified our cutoff that the 50 should be the cutoff value for our research, madam.
Also,
madam, in our questionnaire, we divide them to, in some questions we ask good practice, and some questions we ask bad practice blindly. So we give marks to identify.
Right, okay. Right, okay. So tell me one ethical issue that you addressed when doing your research.
Of course, madam, we use our samples as the human subject, so there is ethical considerations. But we use randomly selected volunteered with informed consent. So
Right, okay. So informed consent was one ethical issue you took. Okay, thank you. Thank you. Well done.
Thank you, madam. Now we will be moving on to the Group 19 presentation. Group members are Pereira WML, Pereira YSSW, Pereira SAST, Pereira VSK, Piris CD, Pumali WR. Over to you.
Hello, I am WML Pereira from Faculty of Medicine and Allied Sciences, Rajarata University of Sri Lanka. We are Group 19. Our research topic is knowledge of non-alcoholic fatty liver disease among 2016-17, 17-18, and 18-19 academic year medical students of state medical faculties in Sri Lanka. As we all know, fatty liver disease have two entities. One is alcoholic fatty liver disease. Second one is non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease is a metabolic disease. In Sri Lanka, the prevalence of non-alcoholic fatty liver disease is 33%. So it is a significant prevalence. So it highlights the need for early detection. Assessing medical undergraduates' knowledge is important for future patient management. What is our objective? This study evaluated non-alcoholic fatty liver disease knowledge among medical undergraduates in Sri Lanka's state medical faculties. Here is our methodology. That study design is a descriptive cross-sectional study. Study setting is medical undergraduates of the 2016-17, 17-18 and 18-19 academic years in the 11 medical faculties of Sri Lanka. Study population consists of 434 medical undergraduates. Our data collection was done as an online questionnaire. Our data analysis was done by using SPSS. This is the result. Here there are 4 graphs. 2018-19 batch means third year medical students. 17-18 batch means fourth year medical students. 16-17 batch means final year medical students. As we can see that knowledge on prevalence, fourth year and final year medical year students have similar but greater knowledge than third year medical students. When we consider about knowledge on diagnostic methods, in that also fourth year and final year medical students have similar but slightly more knowledge than third year medical students. And when we consider about knowledge on potential benefits of vitamin E, in that also fourth year and final year medical students have similar but great knowledge than third year medical students. And when we consider about the overall knowledge in that we can see final year medical students have more knowledge than fourth year medical students. Fourth year medical students have more knowledge than third year medical students. That here we can observe there is an increase of overall knowledge with the academic year. Here the other observation is we can see that all academic years have less overall knowledge than 70%. So here this is our conclusion that overall knowledge about non-alcoholic fatty liver disease among medical students, we can't say it is a good knowledge because it doesn't reach a level of at least 70%. So we can't say it is a good knowledge. So and other thing is the overall knowledge increase with academic year. Most probably that may be due to clinical exposure at the hospital. So targeted educational interventions are necessary to enhance understanding, particularly regarding emerging diseases. So thank you very much.
Now the presentation is open for discussion.
Right. Thank you very much for that interesting presentation. You all can hear me, right? Right. Okay. So now one of the main findings that you have presented to us from your study is that you have seen an increase in the knowledge with the academic year. Is it something that you did not expect, or is it something that you anyways expected?
It is that we expect, madam.
Right. So in that sense, what is the new thing that you are trying to tell us through this research?
We are trying to tell that, madam, that clinical exposure is the main reason for that increased knowledge, but it is also not adequate because final year students also not reach the very good knowledge. That means 70% of the overall knowledge. So we want to show that the knowledge is not adequate, even the final year students.
Okay, so let's take it from there. So how did you define this good knowledge? Is it based on what should be there in the curriculum, or what was your standard?
As usual, madam, we firstly test the lectures doing in the final year and something about doing in the third and fourth year. Then we got the questionnaire from validated questionnaire, the research done before in the Sri Lanka for doctors, medical officers. But we adjust that questionnaire to which suitable for medical students as suitable for their lecture, doing faculty and the clinical.
Okay, so now the questions that you had in the questionnaire are the ones that should have been taught or have learned during the clinical exposure, but they have not learned. Is that your conclusion?
Madam, learning is not adequate, madam, actually.
Right, okay. So in that sense, what would you recommend to improve the situation?
Actually, madam, we like to suggest then it is not faculty problem. We want to suggest that this knowledge is more important. Every doctor who is going to be a HO. So we suggest that common workshop or like seminar or something to all medical students who are in clinical standard workshop or seminar about non-alcoholic fatty liver disease for all medical students who are going to be HO in future.
Okay, right. Thank you.
Thank you, madam.
Thank you, madam. Next, we will see the presentation of group number 20. The group members are Premaratna WGAL, Premasiri MKUI, Rajapaksha GDPM, Rajapaksha KNSK, Rajapaksha ST, Ramanayaka RAGRHK. Over to you.
Hello everyone. I am Aloka Premaratna from Group 20. Our research topic is prevalence of teenage pregnancies and its association between contraceptive awareness among teenagers in Anuradhapura district. Teenage pregnancy admissions notably high in Anuradhapura district, reflecting a concerning trend that requires immediate attention. Addressing the underlying causes such as contraceptive awareness is essential to mitigate this issue. Despite reducing rates of teenage pregnancies at the global level, Rajarata pregnancy cohort results shows a considerable rate of teenage pregnancies in Anuradhapura district, around 22.2%, which exceeds recent local values. Contraception is the intentional prevention of conception through the use of various devices, sexual practices, chemicals, drugs, or surgical procedures. Contraceptives shield teenagers from unplanned pregnancies, but teenagers mostly don't have easy access to contraceptives. Even if minors are able to get contraceptives, they might not know where to get them, how to properly use them, or have the agency or financial means to buy them. And also, lack of contraceptive awareness can lead to poor reproductive health outcomes. According to numerous studies, teenagers who are unaware of or misconceptions about contraceptives are more likely to engage in unprotected sex, which significantly increases the chances of unintended pregnancies and sexually transmitted diseases. So, our main objectives are to assess the contraceptive awareness among the most vulnerable groups of teenagers in Anuradhapura district and to assess the association between teenage pregnancies and knowledge of contraceptive methods among teenagers in Anuradhapura district. For that, a descriptive cross-sectional study was conducted among advanced level students in Anuradhapura district and to assess the association between teenage pregnancies and knowledge of contraceptive methods among teenagers in Anuradhapura district. Hotspot and non-hotspot areas were selected according to the data from Rajarata pregnancy cohort. Palugasweva MOH area, which had 40% prevalence of teenage pregnancies, was our hotspot area, and Kakirawa, which had 12.2% of teenage pregnancy prevalence, was our non-hotspot area. 5 schools from each area was selected randomly. The final sample from the hotspot area consisted of 148 responses and 128 from non-hotspot area. As shown in the results, mean age of the sample was 16.80 years. As you can see, these are the p-values and odds ratios of hotspots compared to non-hotspots. The findings reveal critical differences in contraceptive awareness between hotspot and non-hotspot areas. In hotspot areas, the odds ratios for awareness are notably higher. For example, students in hotspot areas are 4.8 times more likely to have heard about contraception in general, 4.13 times more likely to have heard about contraception from friends, 7 times more likely to have received information about contraception from the media, 16 times more likely to have received formal education about contraception, 8.99 times more likely to have heard about oral contraceptive pills. A staggering 83.7 times more likely to have learned about injectable contraceptive methods. But on the other hand, students from non-hotspot areas shows higher odds ratios for the practical application of contraceptive knowledge. They are 0.04 times more likely to heard about coitus interruptus method, 0.09 times more likely to know how to use oral contraceptive pills, 0.12 times more likely to know side effects of oral contraceptive pills, 0.12 times more likely to understand that condoms are not reusable, and 0.06 times more likely to know that condoms prevent sexually transmitted diseases. In conclusion, overall results suggest that although the individuals who heard about contraceptives are more likely to belong to hotspot areas, they are not aware of the proper technique of using them. It may be the reason for a higher number of teenage pregnancies in hotspot area. These results highlight the disparities between hotspot and non-hotspot areas, both in terms of general awareness and practical knowledge of contraceptive methods. It is evident that while hotspot area shows higher awareness rates, there is a gap in understanding the practical application of these methods. Addressing these gaps, especially in the context of teenage pregnancies, will require targeted educational interventions to improve both awareness and practical knowledge. Schools and healthcare providers plays a major role in raising contraceptive awareness among teenagers. So, we suggest comprehensive sex education programs in schools which will provide an accurate and non-judgmental information about contraception and the prevention of sexually transmitted diseases. So, this is the end of our presentation, and thank you all for your attention.
Now the presentation is open for the discussion.
Very interesting piece of work. So, first of all, I would like to ask how you have defined your hotspots and non-hotspots, because the thing is, to my knowledge, understanding, what you have done is you are having the pregnancy cohort for each area, and out of which which are having the highest percentage of teenage mothers, you pick as the hotspot. Is that so? The identification of areas. How you pick these things? Because in one area it is 40%. Yeah.
Hotspot and non-hotspot areas were selected according to the data from already published research under the pregnancy cohort. There are 12 MOH areas in Anuradhapura district. In Kakirav MOH area, there were 12.2% of adolescent pregnancies in Primigravida teenage pregnancies. So that was our non-hotspot area, and Palugasara.
Palugasara 40%. What do you mean by that 40%?
From all Primigravida pregnancies, 40%.
So if there are 10 pregnant mothers, who comes under the teenage, and who would be teenage mothers.
Yes.
Right. Okay. Anyway, so so you have done your questionnaire based on some previous study, or you have done your own the questions you have asked to assess the knowledge.
The questionnaire was we took the questionnaire from already published researchers.
From one research, or you have taken here and there and decide what are the questions you are going to ask?
We took multiple researchers, and then we took several questions from researchers.
Right. And so did that questionnaire include any questions on emergency contraception?
Yes.
Yes. So any special thing you have noticed? Noticed any special difference between those two areas you have studied? Is it similar? Or there is no such difference?
Emergency contraceptive pills.
Sorry?
Is it about emergency contraceptive pills or the overall results?
No, emergency contraceptive. So not only the pills, the emergency contraception options, do they have any understanding?
We thought that students in hotspot area don't have much knowledge about all of them, but they had knowledge, but they had not seen the practical application of them. Where to buy them?
So you mean the non-hotspot area students had better knowledge on emergency contraception? Is that so?
They had somewhat knowledge than what we think, what we wrote, but we included some questions about emergency contraceptive pills, how to use them, like that, what is the time gap you have to use them after an unprotected sex. But they know there is something like emergency contraceptive pills first, but they don't know the time period.
Right. So based on your study findings, you are saying that in the hotspot areas, the knowledge is higher than the non-hotspot area. So that is what you have found. So if the parents or any social group says that, see, if you increase the knowledge on contraceptive methods, there will be more teenage pregnancies. So then how you are going to answer that kind of interpretation based on your findings? Because you are saying if the knowledge on contraceptive methods are higher, you are high risk group or the hotspot area. So how you are going to answer that?
From the initial of the research, we wanted to influence on the and updating the current guidelines and policies regarding the education relevant to sex education. And we thought it is more reliable to spend contraceptive awareness programs or the awareness programs relevant to these teenage pregnancies than managing the complications of teenage pregnancies.
Okay, right. Thank you.
Thank you, sir. Next, we will see the presentation from group number 21. The group members are Ranavira TK, Ranchagoda ES, Ratnayaka JASR, Ratnayaka RMMP, Ratnayaka RPA, Ratnayaka RPMM. Over to you.
Good day to you all, esteemed panel of judges, distinguished organizers, and my dear colleagues. I'm Ratnayaka RMMP from Research Group 21, here to present to you our research on evaluating the impact of watermelon consumption on blood pressure and probable hypoxia during exercise. WHO reports in 2023 on hypertension estimated that the global prevalence of hypertension has almost doubled within the past 3 decades, from 690 million in 1990 to 1.3 billion in 2019. This highlights that hypertension is a prevalent health issue worldwide. Young hypertension is an important health issue where the early diagnosis and management are vital to prevent the complications. Although pharmacological interventions are available, exploring nutraceutical alternatives for management of hypertension is in great interest. Watermelon is a good source for various bioactive compounds, including citrulline and nitrates, which play crucial roles in vascular health. Objectives of our research were to identify the prevalence of undiagnosed prehypertensive medical students at Faculty of Medicine, Allied Sciences, Rajaratnam University, Sri Lanka, and to determine the blood pressure lowering effect of watermelon and its correlation with physical exercise in prehypertensive young adults. When we turn to the methodology, we utilized a placebo-controlled interventional study design. Study setting was at Faculty of Medicine, Allied Sciences, Rajaratnam University, Sri Lanka. Participation criteria for our study were being a medical student of Faculty of Medicine, Rajaratnam University, between the ages of 21 to 23 years old, and being a newly diagnosed student with prehypertension with the systolic blood pressure between 120 to 139 and diastolic blood pressure between 80 to 89 mercury millimeters. These are the cutoff values for prehypertension taken from WHO criteria. Sampling technique involved interviewer-based questionnaire form filled by voluntary participants. In data collection, the past medical history and lifestyle factors of the participants were taken from the questionnaires, and a daily intervention and blood pressure measurements were taken. Data analysis was conducted using Whitney-Mann U-test in SPSS software, and the ethical clearance was granted from the Ethics Review Committee of Faculty of Medicine and Allied Sciences, Rajaratnam University, Sri Lanka. During the intervention period of 15 days, all the participants were monitored for 1 week by obtaining minimum 3 blood pressure measurements, and 24 prehypertensives were selected to our study. They were divided into 4 groups. There were 2 exercising groups and 2 non-exercising groups. Group 1 and 2 engaged in moderate intensity physical exercise for 30 minutes each day, with only Group 2 receiving 500 milliliters of undiluted watermelon juice. Group 3 and 4 did not engage in physical exercise, with only the Group 3 receiving 500 milliliters of undiluted watermelon juice. Daily blood pressure measurements were taken from every student once prior to their relevant interventions, and after the intervention, 1 hourly up to 3 hours, and lastly after 6 hours from the intervention. When we come to our results, on the left-hand side bar chart, we can see out of 169 total participants, 39 were newly diagnosed as prehypertensives. As a percentage, this is about 23%. From this bar chart, we can see that out of all the prehypertensive students, majority of about 76.9% were males, with only 23.07% being females. When we look at this pie chart, we can see that a significantly larger proportion of newly diagnosed prehypertensives were detected from the male population, which is about 44%, when compared to a very low proportion of about 5% of newly diagnosed prehypertensives detected from the female population. When we look at the average blood pressure change before and after the interventions, here the average blood pressure changes in the two exercising groups have been shown. We saw that the group which consumed watermelon with exercise showed a clinically significant drop in both their systolic and diastolic blood pressure when compared to the group which did not consume watermelon with their exercise. In this chart, we have looked at the average blood pressure change in the two non-exercising groups. Here, the group which consumed watermelon showed a clinically and statistically significant drop in both systolic and diastolic blood pressure when compared to the group which did not consume watermelon. In this line chart, we have shown the systolic blood pressure drop of a single participant from the group which consumed watermelon without exercise during the intervention period. The blood pressure lowering effect of watermelon was observed following 1 hour from the consumption of watermelon, and the lowest blood pressure measurements were seen on average about 3 hours after the consumption of watermelon. In conclusion, there is significantly higher proportion of undiagnosed prehypertension among the male medical student population than the female. The blood pressure lowering effect of watermelon was clearly observed, which peaked after 3 hours of consumption. The test group, who consumed watermelon without exercise, significantly lowered the systolic and diastolic blood pressure. The watermelon with its exercise group showed a clinically significant reduction in systolic and diastolic blood pressure. With this, we have come to the end of our presentation. I would like to thank you all for your kind attention.
Now the presentation is open for the discussion.
Hello everyone. Well done. That's a very interesting piece of work. Right. So to start off with, I don't want a very technical answer, but why did you choose this topic? The actual reason for selecting this?
Hypertension is one of the cause for significant clinical diseases and speak loud. Hypertension is one of cause for a lot of diseases, and we diagnose prehypertension before we can do any intervention to reduce that disease burden. And also like medical students like who are in sedentary lifestyles, there's no any data to prevalence of the prehypertension. That's why we chose it.
What about the watermelon part? Why was that selected? That's the more interesting thing.
We did some literature research, and we found several things like beetroot, watermelon, and the reason for choosing watermelon is in Anuradhapura area is very price, and we still find, and most of them find that.
Right. Okay. Thank you. So now you mentioned that your study design was a placebo-controlled study, right? Yes. Right. So what is a placebo? What do you understand by a placebo?
Placebo is used to eliminate the possible psychological factors which influence the results which were done from the intervention. So the possibility of having any psychological factors, we use this.
So what was your placebo?
Madam, our placebo was a water colored agent, which is one approved one, which belongs to international number system 122 and 127.
Right. So did you mention that anywhere in your abstract or presentation? Right? Right. So, but when an audience is listening, we don't see the proposal. So, if you are presenting this elsewhere, please make sure that you actually include the fact that you used a placebo there, right? So, a very interesting piece of work and well done. Hope maybe you can actually do something about the students you identified from your faculty who are now known to have pre-hypertension. Hope you have done some counseling and things for them as well and referred them to the appropriate places. So all the very best for the rest of your research career.
Thank you, Madam. Now we will be seeing the presentation from group number 22. The group members are Ratnayaka W.M. PBK, Ravaha INF, Rohana HMU, Sadipana JMT, Sajna NF, Samarasekara WA.NV. Over to you.
Good evening, everyone who have attended 6th Undergraduate Research Symposium of Faculty of Medicine and Allied Sciences, Rajarata University of Sri Lanka 2024. I am Fatima Rauha of Group 22 of 2018-19 batch. It is a privilege to present our study titled Evaluation of Dietary Intake and Nutritional Status among a Cohort of Sri Lankan Medical Undergraduates, which is a descriptive cross-sectional study. The link between food and health is long established, with Hippocrates once stating that food be thy medicine and medicine be thy food. Despite this ancient wisdom, a modern lifestyles and dietary habits to continue compromise health by causing nutrient deficiencies and non-communicable diseases. Malnutrition, encompassing both undernutrition and obesity, remains a critical global issue by impacting health, productivity, and quality of life. In Sri Lanka, while obesity is rising, undernutrition also persists. Young adults, especially medical students who have high susceptibility to develop non-communicable disease due to their academic stress, dietary changes along the lifestyle transition. Thus, our study aims to evaluate the dietary intake and nutritional status among medical students at Rajarata University as they represent a key demographic in understanding this nutrition transition. The study focuses on the dietary intake and nutritional status among medical students of our university. We aim to determine the prevalence of underweight, overweight, and obesity in this population, assess their dietary diversity, and understand how the transition of university life affects the nutritional health. By evaluating the nutritional status and analyzing the main components of nutrients in their diets, we hope to gain insight into challenges faced by cohort of medical students in maintaining a balanced diet. To achieve our objectives, we have conducted a descriptive cross-sectional study among medical students of Faculty of Medicine and Allied Sciences, Rajarata University of Sri Lanka from 2023 of July to March 2024. The participants were students who consistently have eaten from regular food source at least 6 months and excluding those with chronic illnesses and pregnancy. We have used a convenient sampling method to match these criteria. For data collection, we have used 24-hour dietary diary, a self-administered questionnaire, and measured anthropometric measurements with height, weight, waist circumference, and hip circumference. From them, we have calculated body mass index and waist-hip ratio to evaluate their nutritional status. Data analysis is carried out using SPSS 16 statistical software and comparison made using a one-sample t-test, where the significance level set at p less than 0.05. An ethical approval for our study is obtained from Ethical Review Committee of our faculty. Let's delve into the results. Our study included 396 participants, with 68% being female with mean age of 23 and 75% of students purchased all meals from the faculty canteen. And the average daily calorie intake among male students were 1,472 kilocalories, while female were 1,416 kilocalories. Both figures are significantly below the recommended daily intake, which is ideal requirement of male is 2,560 and female is 2,099 kilocalories, with a statistical significance of p less than 0.001. This suggests a widespread issue of energy intake, highlighting that the deficit affects the student population as a whole, with no significant difference between the genders as p-value of 0.171. If we consider both the protein intake, the ideal requirement is 48 grams, nearly meeting the 49 grams. So the main protein sources were rice and dal, which contributing 54% of the total protein, underscoring the reliance on traditional staples in the student's diet. If we consider both the lipid intake, a significant concern emerged regarding a fat intake, with approximately 39% of students' total daily calories derived from fats. Exceeding the ideal requirement is 48 grams, since population mean is 63 grams. Prolonged high fat consumption may increase the risk of chronic illness as cardiovascular condition. When we discuss about the BMI distribution, our analysis show that 50.80% of participants are in normal weight, whereas 19.60% is underweight, indicating their low nutrient intake. In other hand, the 14.3% are risk to overweight and 13.3% categorized as overweight and 2% are in categorized of obesity. So this distribution reflects a dual challenge of both undernutrition and overnutrition within the same population. So far, in conclusion, our findings reveal a dietary intake among medical students of Rajarata University of both male and female students exhibit significantly low daily calorie intake, with 35% either underweight or overweight or obesity. Despite near protein consumption, the high reliance on fat poses the risk of chronic illness like non-communicable diseases. This study highlights a dual burden of malnutrition among these students, so emphasizing the urgent need for nutritional interventions to promote their healthier eating practices. To address these issues, we recommend a targeted intervening to increase energy intake by reducing the fat consumption to modification of the regular food sources, integrating the nutritional education into medical curriculum and emphasizing which could promote the healthier dietary habits and practices among students. Future research should investigate factors influencing the student dietary choices, academic pressures impact their nutritional status. Such insights could help to develop the tailored strategies to enhance both physical and mental well-being of the students. This is end of our presentation. Thank you for your kind attention.
Now the presentation is open for the discussion.
Yeah, hello. Can you hear me? Yes. Can you tell me what were the challenges you faced in collecting this information about from this questionnaire? What were your challenges from this group of students?
Thank you for the question, madam. During our study, we take only 24 hours diary because within a week we were unable to take 3 days diary because during a week on Mondays the students are arriving from home and on Fridays they are leaving the faculty and on weekends most of them are at home or and their parents visiting us. So we had a problem with collecting the informations regarding 3 consecutive days. So we only consider about 24 hours diary in collecting the nutritional intake of the students. Because on Thursdays, we have a special menu at the faculty. So those were the basic challenges we faced during collecting the dietary intake of the students.
When you collected this data, was there a contamination of data in the sense because it's a very close group? People may be filling these questionnaires together. How did you overcome some of these obvious issues?
Thank you for the question, madam. Actually, we built the question and tools by our own for that overcome these problems, and we submitted to our food professionalists, and then gathered some suggestions, and then we modified it, and then after that we provide to the target population to overcome these problems. And also there is a challenging with the physical activity because it is directly affected to the nutritional status, and we considered it as all are same as medical students. We are in low and moderate physical activities, and
so in Rajarata there are no sportsmen, sportswomen, no variation. All are studying.
No, madam, as a population, most of them are same habit, and they go to the clinicals and attend to the lectures, and there are no time to.
Okay, so stemming from that answer, what do you think are the confounders of this? What you are looking, you are looking for the outcome variable, right? So you have collected all this data, recall. So what are the other confounders?
One is that physical activity, and the other thing is that we mainly focus on the faculty and canteen as a regular food source. But some of these students, they have dietary habits. They are taking food from another sources, and that is changing, and that's hard.
Thank you. I think the time is over. Congratulations. I think this research is illuminating some of the corners of student life, that are not really well lit. So good effort. Thank you very much. Well done. Well done.
Thank you, madam. Now we will be seeing the presentation from group number 23. The group members are Sandanayaka, KRTR, Samarasinghe, GEDK, Samaratunga, SKIL, Sampath, JMST, Sandamini, PR, Sandeepa, GT. Over to you.
A very good afternoon to all of you. We are the research group number 23 of the 6th Undergraduate Research Symposium of the Faculty of Medicine and Allied Sciences, Rajarata University of Sri Lanka. I'm Rashmendra Sandanayaka, and on behalf of our group, I will be presenting the research findings with you all today. The title of our study is Resilience at Work, its correlates and relationship between resilience and work engagement among government school teachers in the Nuwara Gampalatu East Educational Division. According to the global research evidence, there is a strong positive relationship between teacher resilience and work engagement. It was also found that the motivational and social dimensions of teacher resilience positively impacted teacher job performance and reduced negative job demands and enhanced positive job resources, which would improve their well-being and job performance. In the Sri Lankan context, there are only few studies conducted to assess positive psychological constructs such as resilience and work engagement among school teachers. In this existing local evidence gap, we tried to assess the resilience, work engagement, and associated factors in school teachers in Sinhala Medium 1AB government schools in the Nuragampalada East Educational Division. In the view of achieving this objective, we conducted a cross-sectional study with an analytical component in Sinhala Medium 1AB government schools in the Nuragampalada East Educational Division from July 2023 to July 2024. All male and female teachers in these selected schools at the time of the study were considered as the study population. Out of the 7 1AB government schools in the Nuragampalada East Educational Division, 6 are Sinhala medium schools. We used a self-administered questionnaire to collect data, and the questionnaire comprised 4 main sections. There were questionnaire items on different socio-demographic and other possible associated factors of both resilience and work engagement. With regard to assessing the resilience among teachers, we use validated and culturally adapted Sinhala version of the resilience at work scale Sinhala version and Sinhala version of U-Test work engagement scale to assess the work engagement among teachers. Data analysis was carried out by using the SPSS version 22. Resilience at work was measured on a continuous scale and the score ranges from 0 to 54. So the resilience at work was described using mean and standard deviation of the resilience at work scale score. Independent sample t-test was conducted to compare the mean resilience scores between different subgroups, and Pearson correlation was used to assess the relationship between resilience and work engagement subscale scores. The work engagement subscales were vigor, dedication, and absorption. The final sample consisted of 448 teachers. The majority were females with approximately 75% of female teachers. The mean age of the sample was 44.8 years. The resilience at work scale score ranged from 43 to 93 with a mean of 71.5 and the standard deviation was 7.1. Statistically significant positive relationship emerged between resilience score and the 3 subscales of work engagement, namely vigor, dedication, and absorption. Teachers who are under 50 years of age, unmarried or widowed or divorced, teaching in primary section, and teachers having better job satisfaction, supportive working environment with co-workers, supportive student-teacher relationship, administrative support, good parental support, and satisfactory facilities reported to have higher mean resilience scores than their counterparts. Based on our study results, we concluded that resilience at work is high among teachers in Sinhala medium government schools in the study setting, positively correlating with all work engagement subscales. Various socio-demographic and work-related factors are associated with resilience among teachers, highlighting the need for targeted support mechanisms in this context. Thank you very much.
Now the presentation is open for the discussion.
Okay, thank you very much for that very interesting presentation. So firstly, can you tell me what is the definition of resilience?
Thank you for the question. Look at resilience means ability to return back to a normal functioning state after exposure to stresses. Teachers' resilience means
ability to overcome the difficulties and adapt to the various settings.
Okay, so you used a validated questionnaire, correct, to measure resilience. Among whom was it validated? It was a Sinhala validated questionnaire, right? So among whom was it validated, the questionnaire in Sri Lanka? What was the study population it was validated for?
Thank you for the question, madam.
Sorry.
Thank you for the question, madam.
Ah.
Resilience at work scale is validated nursing of Sri Lanka. Nursing population.
Okay, right. Okay. Then what is the definition of work engagement? How do you define work engagement?
Thank you for the question. Work engagement means positive, fulfilling, work-related mind that is characterized by vigor, absorption, and dedication.
Right. Okay. So can you tell me can you name a few ethical issues that you took into consideration when carrying out this study?
So thank you for the question, madam. While doing the research, the validated questionnaires are validated and culturally adapted for the Sinhala and English medium only. So we would have to only include it from our population, Sinhala medium schools only. So we have to exclude the Tamil medium schools from our population.
Any other ethical issues you took into consideration when carrying the research? Okay, so things like informed consent, you took their consent, right? Okay, they were not forced to come. Okay, right. Okay. So can you tell me one measure you took to ensure that your study findings were valid?
Thank you for the question, madam. The fresh work engagement scale and the resilience at work scale, and those are validated for nursing and student populations in the Sri Lanka, but not validated for teaching population. We discussed with our supervisor and experts who validated these questionnaires and give their opinion about whether these questionnaire items are culturally and contextually acceptable for our teaching population. And with those, we proceed with the tools.
Right. Okay. Thank you. Well done and all the best.
Thank you, madam. With that, we will have a 10 minutes break before moving into the next half of the presentation. So please remain signed in. And meanwhile, you can enjoy some interesting captures from the previous undergraduate research symposia. Thank you. Welcome back. So let's continue with the presentation from group number 24. The team members are Sendanayaka DH, Sarambage P, Senadira KMT, Senanayaka HKK, Senanayaka MBSC, Seniviratna DMKU. Over to you.
Good day to the distinguished audience. My name is Kuisha Senanayaka. I'm from group number 24, and this is the knowledge and prevalence of self-medication with analgesics among the undergraduates of Rajata University of Sri Lanka. Every day, the world over, 1 in 9 individuals complain of some sort of ailment or pain. And among these, 1 in 4 admit to using over-the-counter analgesics without consulting a doctor prior. This is what we call self-medication. Self-medication can be a beneficial practice. It can spare the consumer from having to wait in long lines, and it can also spare them financially. However, this seemingly harmless practice can at times lead to disastrous consequences. Let me give you some examples. In the United States alone, 50% of all acute liver failure cases were attributed to acetaminophen poisoning. And 100,000 hospitalizations per year were attributed to complications that arose from chronic use of non-steroidal anti-inflammatory drugs. In Sri Lanka, this situation is not that different. One study showed that 20 to 25% of all poisoning cases in Sri Lankan hospitals were attributed to paracetamol overdose. As for non-steroidal anti-inflammatory drug use, 15% of all individuals presenting with upper gastrointestinal bleeding had a history of non-steroidal anti-inflammatory drug use. With this, as Sri Lankans, we have some background knowledge on the possible harms of using these drugs as self-medication. However, there is still a major gap in knowledge when it comes to the prevalence rates in Sri Lanka and the perceptions of the Sri Lankan consumer. This is the knowledge pool we wanted to add to through our research. For this, we devised a descriptive cross-sectional study that was conducted among the undergraduates of Rajata University of Sri Lanka. A total of 400 volunteer participants from all 6 faculties in the university were recruited as the study population. A majority of these participants were from the medical faculty. This is important to note. A self-administered questionnaire was circulated among them via a Google form. With this research, we wanted to focus on several key areas. The first one being prevalence. 84% of all participants admitted to using analgesics for self-medication at some point in their lives. So how does this number tally with the global rates? It's important to note that global prevalence rates vary from country to country and even between communities. This is evident by Brazil showing 76.1% prevalence rate, India only 71.3%, but in Spain this was 46.3%. The reasons for this discrepancy is unknown, but there is a considerable variation. With regards to why people chose to do self-medication, headache, fever, and common cold were the commonest causes for self-medication. And as you may have already imagined, paracetamol is the most commonly used analgesics among our volunteers. This was followed by diclofenac sodium and mefenamic acid. Then we looked into the inclinations behind their choice. Some had experienced similar symptoms previously. Others had believed that their condition did not merit seeing a physician. Some had available to them the medications used by family members, or they had prescriptions that were previously used by family members, friends, or themselves. With regard to access, most had accessed the medication through a pharmacy, or they had just acquired the medication through family and friends from either previous illnesses or from their previous prescriptions. When we looked into the safety issues, 41% used more than one painkiller at a time. 80.2% followed recommended dosages. With regard to knowledge and awareness, 31% knew about the possibility of overdose, only 31%. 80% knew about the possibility of drug interactions, and 77% knew about the possibility of addiction. 68% knew about the possibility of drug tolerance. 73% knew about the possibility of side effects. Now, with all these results taken into consideration, we found that the results were consistent with trends seen globally among undergraduates. That is, there was a high incidence of self-medication rates among the undergraduates that we recruited for this study. We also found that there is considerable knowledge among these undergraduates about the potential risks involved with this practice, but they still chose to go this route because of convenience or other reasons. We also found some gaps in knowledge about the possibility of overdose, dosage compliance, and of course, possible drug interactions. In conclusion, we believe that implementation of awareness programs among undergraduates is desirable. Research should expand to involve the public perception because the undergraduate population comprises a very niche population. It's the results that we obtained through this research are in no way generalizable to the public. Therefore, we believe that the research should expand to involve the public perception. And finally, we also believe that evaluation of the adherence of healthcare stakeholders to the rules and regulations pertaining to the sale and distribution of prescription and over-the-counter drugs. By this, we mean that because a majority of our of our participants had accessed the medication through the pharmacy, it's important to find out whether the pharmacies adhere to the regulations that are already in place about the sale of prescription and over-the-counter drugs. If this process did happen according to the regulations, then it would be unlikely to see the many cases that we see in hospitals with young teenagers coming after consuming about 100 tablets of paracetamol. Therefore, we believe that there should be some regulation and there should be adherence to the regulations that are already in place. With that, we come to the end of our presentation. These are the group members who worked tirelessly for this endeavor. Thank you so much for your valuable time.
Now the presentation is open for the discussion.
Right. Thank you for that presentation. It is a very important area of study and very well presented also. Yes, I have a few clarifications. Now you mentioned the use of drugs by the generic names in your presentation. How did that appear in your questionnaire? You used only the generic names, or did you have the brand names also in the questionnaire?
We mentioned both generic name and the brand name. We mentioned both in the questionnaire.
So how did you find all those brand names?
Can I answer, madam? For some of the medication, the popular brands, we included them inside brackets. So one might not know what ibuprofen is, but to remedy that, we put in Brufen on the brackets.
Right, okay, because I was just curious because your sample comprised of medical as well as non-medical undergraduates, right? And some of the drugs may not be known by their generic name by the other students, right? One more clarification. Now you have mentioned about 80% have used more than one painkiller at a time, right? Is that more than one tablet or capsule or more than one type of drugs? What did you mean exactly?
More than one type of drug.
More than one type of drugs at the same time. Okay, right. Right. Now, with your findings, you have noted that it is not really the lack of knowledge that has driven their practice, right? So then what do you recommend to improve the situation?
Madam, thank you for the question, madam. We think that it's appropriate to conduct some awareness programs about the correct way to use self-medication, because, like I said, it is a very beneficial practice. It can be a beneficial practice. So instead of trying to stop it, we should find ways to do it efficiently. This is called responsible self-medication. So we can educate the undergraduate population on how to carry this practice in a safe manner.
Right, okay. Now one final question about the generalizability. Now, what are the limitations for generalizing the findings?
Like we said, madam, this population comprised mainly of there was a majority of medical students. So it's hard to generalize to the undergraduate population, and the undergraduate population is altogether very different from the public, madam, because of the age and of course their educational status. So because of these factors, it's hard to generalize the study to the public.
Right, good. Right, again, well done. An interesting study as well as presentation.
Thank you.
Thank you.
Thank you, madam. Now we will be moving to the presentation from group number 25. The group members are Silva MUU, Suravira SMNJ, Sevandi LGK, Silva DKD, Silvardhana SMIM, Seneviratna DLUC. Over to you.
Good day to you all. Esteemed panel of judges, organizers, and my dear colleagues. I am Ms. Silva, MUU, on behalf of Research Group 25 to present you our research, which is Awareness and Attitudes Regarding First Aid After Snake Bite and Knowledge Regarding Identification of Venomous Snakes in Sri Lanka among farmers in Noragampalata Central Divisional Secretariat Division in Anuradhapura District. There are approximately 3,000 species of snakes worldwide, out of which 10 to 15% are venomous. Snakebite is an ecological phenomenon, and snakebite was declared as a neglected tropical disease in 2017 by World Health Organization. Sri Lanka, a tropical South Asian island, has 105 terrestrial snake species, of which 6 have been identified as medically important because of their venomosity. They are Russell's viper, common krait, saw-scale viper, Ceylon krait, hump-nosed viper, and common cobra. Snakebite is an occupational hazard in Sri Lanka, which involves farming communities. The highest snakebite incidence, mortality, and case fatality recorded in dry zone, particularly in North Central Province. So, provision of first aid following a snake bite can be life-saving until definitive care is provided. And also, identification of venomous snake is essential for effective patient management, because misidentification can lead to inappropriate handling, which potentially increase snakebite incidence. So there is a need to assess awareness and attitude of farmers regarding first aid after snakebite and their knowledge on venomous snake identification. In our methodology, a descriptive cross-sectional study was conducted on randomly selected both male and female farmers
who are between 18 to 70 years of age and registered in agrarian developmental centers in Alapattur, Gammirigaswawa, and Saliyapura, which are 3 divisions of Nuragampalata Central Divisional Secretariat Division in Anuradhapura district. Study was conducted using printed questionnaire, and following data collection, data analysis was performed by using IBM SPSS software. A total of 425 farmers responded, and among that 52.9% is male and 47.1% is female. As you can see in our first bar graph, we assess attitude and awareness of the farmers regarding snake bite and also first aid. So, as you can see here, a 78.8% aware on importance of administering first aid after the snake bite. But only 20.9% has confidence to administer first aid following a snake bite. The vast majority of farmers recognize the necessity of promptly seeking hospitalization after snake bite. And in our second graph, we assess the first aid practices following a snake bite. And here, majority of farmers agreed on wound cleansing with soap and water following a snake bite. And also 77.4% farmers agreed on removing tight clothes and rings around the bitten area after snake bite. Although majority were knowledgeable about recommended first aid like wound cleansing with soap and water after the snake bite and also removing of tight clothes and rings following the snake bite, still 68.7% of individuals considered applying tourniquet as a necessity which is contraindicated following a snake bite. And only few percent of farmers agreed on suction of the venom out of the wound following snake bite by healthy volunteer. And as you can see here in this table, we assessed the ability of identifying the venomous snakes of Sri Lanka by farmers in Nuragampalata Central Divisional Secretariat Division in Anuradhapura district. And here, majority can correctly identify hump-nosed viper and saw-scale viper. And also, comparatively, higher percentage of farmers can identify non-venomous snake such as rat snake, python than venomous snake. And also, they have difficult to differentiate the common trait from the Ceylon trait. So in a conclusion, overall awareness and attitudes regarding first aid after snake bite among farmers in Nuragampalata Central Divisional Secretariat Division of Anuradhapura district was satisfactory. Still, a significant percentage of farmers held misconceptions regarding first aid following a snake bite. And also, farmers showed greater proficiency in identifying non-venomous snake than venomous snakes. Thank you for listening.
Now the presentation is open for the discussion.
Congratulations, nice presentation. And I have few clarifications. The methods you have described, how you have recruited the study participants.
So we first visited these 3 agrarian developmental centers, which are Gammirigaswawa, Alapattur, and Saliyapura. And we met the agrarian developmental officers, and they had the list of the farmers. And altogether in 3 centers, there are nearly like 5,000 farmers. And from this list, then actually we asked the help from this agrarian instructors, and they with the help of them, we arranged the meetings for the farmers. Usually the meetings were held once in 3 months, but with the help of these agrarian instructors, we arranged the meetings, and then we distributed our questionnaire in that meetings.
So you have mentioned that you have conducted this study among a group of randomly selected farmers.
Yes.
Then is that correct? Is your sampling technique is random?
So there are around 5,000 farmers that are registered under the divisional secretariat division, and out of them, the farmers who randomly participate in the meeting and who volunteered to participate in the questionnaire were selected. So therefore, we think that it's a random.
So can you call it random sampling? I agree that you had the sampling frame, but my concern is whether you gave enough equal opportunity for all the farmers to get into the study.
But that was a limitations in our study, sir. That
Yes, that's true. So it is not random then. And my other question is, what is the sample size you have calculated? I mean, the estimated sample size?
127, sir.
What? Sorry?
427, sir.
127. All right. So
427.
right. So then, what about the response rate?
We got the 425. Actually, we distributed more than the 427 questionnaires, and we only got the 425 response.
So that means you are again telling that this is not random sampling because you are targeting something more than that, and ultimately you gone up to the number of participants you want, right? So what about how you have assessed their ability to identify snakes, venomous or non-venomous?
In our questionnaire, we printed the snakes photos, and then we asked them to write the name of the snakes in the questionnaire.
Right. Thank you. Good luck.
Yes, sir.
Thank you, sir. With that, we will be moving to the presentation from group number 26. The group members are Tharushi MK, Tennakon TMNA, Tennakon TMRC, Talgahagoda TP, Tatsarani MNT, Tatsarani WMSA. Over to you.
Good afternoon to you all. I'm the principal investigator of research group number 26. I'm going to present the findings of our research on knowledge, attitudes, and practices of contraceptives among pregnant women in Teaching Hospital, Anuradhapura. To begin with, unplanned pregnancies continue to be an emerging public health concern, not only globally, but also in Sri Lanka. Knowledge about contraceptive methods is crucial for family planning, reducing maternal mortality, and improving child health. Despite the availability of contraceptive methods, there is still a notable deficiency in the data on how these methods are understood and practiced by pregnant women. This study aims to fill that gap by exploring the knowledge, attitudes, and practices of contraceptives among pregnant women in this region. Our primary objective is to explore three key aspects: knowledge, attitudes, practices in relation to contraceptive methods among pregnant women in Teaching Hospital, Anuradhapura. This study was designed as a hospital-based descriptive cross-sectional study. The study population included pregnant women in between the ages of 15 to 49 who attended the antenatal clinics at the Teaching Hospital, Anuradhapura. We used an interviewer-administered questionnaire to gather data. Ethical approval was obtained from the Ethical Review Committee of the Faculty of Medicine and Allied Sciences to ensure the ethical integrity of our study. Let me now take you through our findings, which have been categorized into 3 sections: awareness, attitudes, and practices. The graph on the top right illustrates the level of awareness about various contraceptive methods. The majority of the respondents were aware of traditional and modern contraceptive methods, such as oral contraceptive pills, intrauterine contraceptive devices, and condoms. Conversely, methods like female condom and basal body temperature cervical mucus method showed a striking lack of awareness, which highlights the need for better education on less common contraceptive options. Next, let's move to attitudes. As seen from the pie chart, 55.47% of the women had a positive attitude towards using contraceptives, while the remainder had negative views. A significant number of women expressed concerns about the potential health effects of hormonal contraceptives, believing that these methods negatively impact health. But majority says that the hormone contraceptives does not affect health. 96% of the women believed that it is crucial to be aware of birth control options even before engaging in sexual activity. More than 90% of pregnant women had good access to family planning services. Some even believe that using contraceptives before the first pregnancy could cause infertility. Finally, let's talk about practices. As seen in the data, the oral contraceptive pill was the most commonly used modern contraceptive method utilized by 55.47% of the women. On the other hand, the female condom was the least used, with only 0.26% of women reporting its use. Among natural methods, the calendar method was the most practiced, with a prevalence of 17.12%. Interestingly, the basal body temperature method was not used at all by any respondent. This further reinforces the importance of improving education on both modern and natural contraceptive methods. In conclusion, our study reveals that awareness and practice of modern contraceptive methods are significantly higher than that of natural methods. Most pregnant women held positive attitudes towards contraception, with some negative perceptions, particularly around hormonal methods, and their health effects remain prevalent. Addressing these concerns through educational programs could help improve not only the knowledge but also the acceptance and practice of contraceptive methods. Thank you.
Now the presentation is open for the discussion.
Hello, thank you very much for that presentation. It's very interesting. I have some questions from you to test you as well as for me to learn. So tell me, why did you select this this sample, this group for this study? Pregnant women?
Thank you, Madam, for this question. We selected this sample because pregnant women are a critical age, are in a critical age in their reproductive life. Because of that, we thought of doing this research using this sample, and also after the delivery, they usually use a contraceptive method before their next pregnancy, and assessment of their knowledge about contraception is important. That's why we selected this group.
Okay. All right. Yeah, okay. So I just want to ask you for my general interest, how many of you have seen a female condom?
We have seen during our practicals.
These all your friends have seen it?
Yes,
Yes,
madam.
ma'am.
Where have you seen it?
In the physiology practicals.
In the physiology practicals. Is it commonly available for purchase? Because you say like they don't know it, they don't use it. Do you think that it's available?
Not commonly available.
Sorry?
Not commonly available.
I can't hear you. Actually, I can't hear all of you very much.
It is not commonly available, madam. But and the data awareness of the about the female condom is actually very low.
Okay. All right. So when you said pregnant women, can you please tell me again at what sort of at which trimester of pregnancy did you say you selected this sample? Anyone, is it your recruitment criteria?
We recruit the pregnant mothers from age from 15 to 49, and all the trimesters we recruited all pregnant mothers in all trimesters. We excluded the pregnant mothers between 15 and 18 who has no guardian, and the pregnant mothers who has been arrested by someone. All the other pregnant mothers.
Yeah, why did you eliminate the teenage pregnancies? Don't you think that's, yeah, why did you do that?
We didn't eliminate teenage pregnancy. We recruited from age 15 to age 49. We excluded only the teenage pregnancies who do not have a guardian.
What do you mean a guardian?
It
Like
means-
say you're 18 and you don't need a guardian, right? Like that's an adult. What do you mean a guardian who has not come to the clinic with a guardian, is it? Or who do not, what do you mean by who do not have a guardian?
A mother that who has not married until not married yet, or not living with his or his her parents.
Why does that make you exclude a pregnant person who probably is one person who really should have known about contraception? Why are you eliminating such an important person from your study because of a guardian?
Madam, we had to take proxy consent from teenagers. So if we couldn't take proxy consent from guardian or parent, we excluded those pregnant mothers, teenagers.
So even someone who's 18, you have excluded? Why does she need a proxy consent? If she can vote, she can consent for your study.
No, madam. We excluded 15, 16, 17.
Oh, all right. Okay. But if you had to choose an alternate study sample, who would you ideally select? Maybe you did this because it's easy, to. Oh, sorry. The 3 minutes are over. So all the best to you. Thanks. Sorry, I have to stop taking questions. Thank you.
Thank you, madam. Now we will be moving on to the presentation from the group number 27. Group members are Tennakon TMSH, Tennakon TMTS, Tilakaratna RAJS, Tilakaratna UANN, Tilakasiri MJH, Vitushka PKDI. Over to you.
Hello everyone, I'm Sanali Tennakon. We are research group number 27. I'll be presenting on our research on contaminated theatre footwear, a potential source of infection in Teaching Hospital Anuradhapura. Operating theatre staff must wear specialized footwear to reduce the risk of infection transmission. Despite the awareness of health risks, inadequate hygienic practices persist due to facility limitation and knowledge gaps. Our study at Teaching Hospital Anuradhapura investigate microbial contamination in theatre footwear, potential risk to theatre wearer, emphasizing the importance of proper cleaning practices to prevent potential pathogens while comparing the current practices with the proper guideline provided by the Hospital Infection Prevention and Control Manual by Sri Lankan College of Microbiologists. Our generalized objective is to determine the level of microbial contamination of the theatre footwear with potential pathogens and adherence to proper cleaning procedures of these footwear in Teaching Hospital Anuradhapura. For that, we used 35 regular theatre staff were included in the study. An interviewer-based questionnaire was conducted among the participating theatre staff. Swabs were taken from inside of the footwear and lower surface of first and second toes of the wearer before wearing at 4 hours after wearing the shoes. Swabs were put in 10 milliliters of sterile saline and Vortex. 0.5 milliliter of the sample was spread plated after serial dilution in blood agar and separated dextrose agar for bacterial and fungal growth. Blood agar plated incubated at 37 Celsius for 24 hours and separated dextrose agar at room temperature for 5 days. Bacterial colonies were counted using colony counter, and identification of bacteria and fungal were carried out using standard methods. A separated questionnaire assessed theatre footwear cleaning procedures of 15 cleaning staff. Our results are, among the collected samples, 68.5% were from common pairs, while 31.4% from own pairs. 28.6% from morning shoe samples had colony count greater than 300. While in afternoon shoe samples, it was 40%. Sample collected 4 hours after wearing the shoes had a higher bacterial growth compared to morning. Bacterial colony count of morning shoe samples were lower at the beginning of the week than at the end of the week. During bacterial identification, gram-positive cocci were commonly identified. Among them, Staphylococci were a majority, while Streptococci were a minority. Least identified bacterial group was gram-negative cocci. When comparing the bacterial colony count before and after 4 hours of wearing shoes, 40% of samples had increased colony count in later sample, while 37.1% of the samples had no change in their colony count. According to the fungal identification, Fusarium was the commonly identified group, which was 54.2%. 45.7% of Aspergillus niger could be identified. 5.7% of Trichobiton could be identified, which was a minority. Qualitative assessment of 15 health assistants relieved theatre footwear are cleaned once a week, except for the blood-stained theatre footwear, which are cleaned every night. T-pol is the main chemical used to clean theatre footwear. Our final conclusion, the presence of Staphylococcus and Streptococcus species along with fungal isolates highlights the importance of regular cleaning and maintenance of footwear to mitigate contamination. Dedicated footwear considered as a piece of personal protective equipment for hospital staff, and they fall under jurisdiction of Standard EN ISO 20347/2012. Current practices such as inadequate drying and improper cleaning methods contribute to increased bacterial and fungal growth, exacerbating the risk. Furthermore, the lack of proper footwear standards and maintenance protocols necessitates urgent attention to ensure staff safety and infection control measures. Thank you very much.
Now the presentation is open for the discussion.
Right, well done, everyone. Again, it's a very interesting piece of work. May I know who actually did the lab work? Did you all actually do the lab work part also?
Yes, madam. All of us did the lab work.
Lab work, right. Okay. So now in your title, I just want a couple of clarification. It is said that contaminated theatre footwear, potential source of infection. Now, for whom are you thinking about when you call the theatre footwear as a potential source of infection?
Thank you, madam, for the question. During our study, we assessed the risk for the wearer.
Right. Okay. Thanks. Right. Only for the wearer, right? And in your abstract, do you all have your abstract with you now? No. Right. So I'll read the conclusion you have in your abstract, right? So there is a statement which says, malpractices in footwear use and cleaning can lead to infections, including bloodborne diseases like hepatitis B and HIV. Can you comment on that statement, please?
Yes, madam. The current practices practiced in Teaching Hospital Anuradhapura, we assess them according to the guideline provided by the Hospital Infection Prevention and Control Manual by Sri Lanka College of Microbiologists.
Can I interrupt you there? Is there actually a theatre footwear cleaning guideline in that?
Yes. There are few statements regarding how a theatre footwear should be managed.
Right. Okay.
The manual. According to that, it has been mentioned that a blood-contaminated theatre footwear must be cleaned immediately using 1% hypochlorite. But when we assess that in the hospital, we were able to find that the blood-contaminated theatre footwear are not cleaned immediately at the hospital. They are collected and cleaned at the end of the day using peroxide, not using 1% hypochlorite.
Right. So, okay. Now, do you think, practically anywhere in the world, have you seen, have you looked at other literature to see what people practice in other countries?
In Sri Lanka, they have not done any studies, similar studies in Sri Lanka, but in foreign countries, they have done similar studies. And according to their guidelines, the blood contaminated footwear, they mentioned that they should be cleaned immediately.
Right. Okay. Thanks. I'll stop you there, but I'll ask a quick question from someone else because others also need to speak, right? It's a group project. So now you were talking about percentages of contaminations and all, no? Now, did you actually compare those percentages, at least in literature, with what is found in normal footwear? Like, the shoes that you wear, the shoes that someone will wear regularly. Have you compared the percentages, the isolates and things, because you're trying to highlight that the theatre footwear is now contaminated and may lead to infections? So did you actually compare it with the regular things that are, studies that have been done?
Madam, there was a study which was done in Sri Lanka, Faculty of Medicine, Colombo, and their research was about the comparing the both theatre footwear and the outside shoes about the cross-contamination of the theatre footwear. At that study, they have mentioned in the outside footwear, the main, the predominant microorganism which was isolated was the Bacillus species. In our study, we mainly isolated gram-positive foci. Among them, majority was Staphylococcus.
Right. Okay, thanks. You have done that. No, the time is up, so I'll stop you there. But read a bit more broadly on that, particularly with the methods that you have used. Okay. Right. All the best. Interesting piece of work.
Thank you.
Thank you, madam. With that, we will be moving on to the next presentation from the group number 28. The group members are Tishakya MA, Vidarshana KKP, Vimuktika RHT, Vanigasekara DPKK, Veerakkodi WMTL. Over to you.
Dear all, we are group 28. I am going to present our research on knowledge, awareness, and practices of controlling infectious and chemical hazards among anatomy laboratory workers during CADOP research. Here, I will talk about the background, objectives, methodology, results, and conclusion of our study. Anatomy laboratory workers who preserve cadavers should have proper awareness on infectious and chemical hazards and should follow safety practices while cadaver preserving. We have seen a lot of improper practices among the anatomy laboratory workers during cadaver handling and preservation during our first and second year of medical student life. This research investigates the awareness and practices of controlling infectious and chemical hazards among them. Our objectives are to assess awareness and practices of infectious and chemical hazards of anatomy laboratory staff who preserve cadavers for medical faculties in Sri Lanka. The methodology of our study: we did a descriptive cross-section study. It was conducted among cadaver preserving anatomy laboratory staff using self-completed printed questionnaire. Data analysis was done manually to assess knowledge, attitudes, and practices with the scoring system. Scores more than 75% considered as good. Scores in between 50 to 74% considered as moderate. Scores less than 50% considered as poor. When we go through the result of our study, awareness on health hazards related format. Awareness on most of the health hazards are in good amount, and the most recognized health hazard is carcinogenicity. But the least recognized health hazard is germ cell mutagenicity. It is 41.46%. Next, we assess the awareness about infectious agents can be transmitted during cadaver preservation. Here we assess the awareness about the tuberculosis, HIV, COVID-19, hepatitis B and C. Awareness about the hepatitis B and C are in good amount, but awareness about tuberculosis, HIV, and COVID-19 are in moderate in amount. Then we assess the awareness of mode of transmission of infectious agents through cadavers. Awareness about the modes of transmission are in good amount in between this population. Next, we assess the awareness about availability of vaccines against tuberculosis, hepatitis B, and COVID-19. Awareness about the presence of vaccines against hepatitis B and tuberculosis are in moderate in amount, and awareness about the presence of vaccines against COVID-19 are in good in amount. Though 75.61% knows about the presence of vaccines against hepatitis B, only 36.59% of the population have taken the vaccine against hepatitis B. And as well as we assess the good practices during cadaver handling, most of the population follows good practices during cadaver handling, but only 39.02% of the population wears gas mask during cadaver handling, and 48.78% of the population wears goggles during cadaver handling. The reason we have recognized for the lack of usage of personal protective equipment is the lack of availability of those personal protective equipment in those faculties. At last, we assess the good practices after cadaver handling among this population. Most of the population follows good practices after cadaver handling, but 39.0% of the population washes immediately with soap and hot water if skin is contaminated with blood or body fluids. And the conclusion of our study, a high awareness level observed among Sri Lankan anatomy laboratory workers about chemical and infectious hazard related to cadaver preservation, and enhanced skill training and implementation of strict safety protocols might be needed to rectify the observed gaps in knowledge, skills, and practices. So that's all of our about our research. Thank you.
Now the presentation is open for the discussion.
Okay, thank you very much for that interesting presentation. So you mentioned that you did this study on anatomy workers in the medical faculties of Sri Lanka. So how many medical faculties did you all target? What was your study population?
We did the study, madam, in the all of the anatomy departments in Sri Lanka, except Moratuwa medical faculty. And the decision was taken as the population.
Okay, so what was your sample size?
Sample size was 41.
41, okay. And sampling method?
Sampling method, madam, cross-sectional study, descriptive cross-sectional study.
The sampling method, not the study design. What was the sampling method you used to get your sample size?
But actually, we did not calculate sample size because we take the whole population as a sample.
Okay, so you took everybody. There were 40 in all the medical faculties, is it? Okay, right. Okay. So you said that you determined knowledge with a cutoff at 75 and 50 for good and moderate. So how did you decide on those cutoffs? What is your justification for using those cutoffs?
Madam, we developed this questionnaire and cutoff levels based on previous research, which is published on Sri Lanka Journal of Infectious Disease 2017, published by Sri Lankan College of Microbiologists.
So you used the exact same questionnaire, is it, or you modified it?
Same questionnaire.
Same questionnaire. Okay. So this questionnaire is a validated questionnaire, or how is it? Is it validated for use in our country?
Yes, madam. It was validated in those that research.
Okay. Right. Okay. So tell me, what are the ethical issues you addressed while carrying out this research?
During our study, initially we took the ethical review committee consent from our faculty ethical review committee, and after that we contact via emails to the deans of the other anatomy, deans of the faculties and heads of the Department of Anatomy. And we took consent from them and using a printed consent form
Okay.
from the participant, we took the consent from them.
Okay. Just interested to know what was your response rate? Out of 40, you said 40 were the total number of in your study population. What was the response rate? All of them, you had 100% response rate? All of them replied via. Okay. Right. Okay. Tell me one method you took to ensure that your study findings were valid. So it was online questionnaire, no, you sent it online. So what are the measures you took to ensure that you got valid findings from the respondents?
Madam, it's not actually an online questionnaire. We went to the faculty and give a printed questionnaire to all of them. And they don't know that although we collect.
So you visited all these medical faculties. Okay. So you had a nice trip also during your research. Okay. Right. Okay. Very nice research. Okay. Thank you.
Thank you, madam. Now we will be moving on to the presentation from the group 29. The team members are Veera Singha MSW, V Singha WMGP, Vikramasinghe LMAP, Vikramatilaka AATS, Vijayananda JY, Vijay Kuruppu WMAT. Over to you.
Good evening. I am Peshika Vikramasinghe, and we are here to present our research on a qualitative study to explore perceptions and knowledge of contraceptives among university students at Rajarata University of Sri Lanka. Since the dawn of 20th century, there have been substantial changes in fertility, mortality, family planning, and contraceptive use in Sri Lanka. Globally, in 2019, approximately out of 1.9 billion women of reproductive age, 1.1 billion required family planning. Previous research data indicates an increase in the rate of unintended pregnancies ending in abortion from 48% to 72% during 1990 to 2019 in Sri Lanka. This trend highlights the urgent need for improved access to family planning resources. The lack of information on the reproductive and sexual health requirements of adolescents in Sri Lanka has been stressed as an area of public concern. Contraceptive knowledge among university students has been explored inadequately. In our research, we aim to explore perceptions and knowledge of contraceptives among university students at Rajarata University. To explore university students' perceptions of teenage and unplanned pregnancies, and to identify barriers to contraceptive usage among university students. With the aims of achieving our objectives, we conducted a qualitative study designs participating undergraduates from Faculty of Management, Social Sciences, Applied Sciences, Medicine from Rajarata University. We conducted semi-structured interviews and thematic analysis. Ethical approval was obtained from Ethics Review Committee, Rajarata University of Sri Lanka. Our study involved 20 to 23 years old, unmarried, 19 university students comprising 11 females and 8 males. By the end of our data collection, followed by analysis, we identified 4 major themes. Basic knowledge of contraception, feelings toward the term contraception, myths, beliefs and perceptions regarding contraception, including teenage, and unwanted pregnancies, and specific knowledge of contraception. Under basic knowledge on contraception, we get what are the understanding regarding contraception. Some students understands birth control is fulfilling sexual desire without getting pregnant. Contraceptives prevent unwanted pregnancies. One student said that contraceptives are the medications used for abortions. Condoms, pills, surgeries, injections, and abortions as identified as methods of contraception. Under perceived knowledge on contraception, we observe their myths, beliefs, and thoughts. Some students believe contraceptive methods may have negative effects. Contraceptives are used to kill a fetus, which is a fault. And they suggest contraceptive knowledge should be improved. Under feelings toward the term contraception, they had both positive feelings and negative feelings. Some students appreciated the topic of contraception. They said they do not feel shy to talk about contraception. One student said that it is good to talk about contraception. This is something that has to be discussed in society. At the same time, some had feelings against contraception. One student said that I'm telling not to engage in contraception. I do not like to kill babies like that. So finally, we understand cultural and religious norms often impede the dissemination of contraceptive knowledge, obscuring the actual need for contraceptives among this population. The reluctance of school teachers to educate students on sexual health contributes to a lack of contraceptive knowledge, further exacerbated by the inadequate coverage of sexual health in school syllabus. These are our group members.
Now the presentation is open for the discussion.
Right. Thank you. And this group of course has taken the challenge of trying out a challenging design on a challenging topic, I would say. So did you all had any training on qualitative study methods prior to be embarked on this study?
Thank you for the question, madam. Yes, madam, we did. We were given an introduction and we were taught on qualitative research by our research mentor.
Right, okay. Now, how many semi-structured interviews that you conducted all together?
Altogether, we conducted 19 interviews and we did 8 pre-testing interviews as well.
Okay, 8 pre-testing interviews. Why that many?
Madam, during the pre-testing, we conducted 8 interviews, and after each interview, we gathered and discussed. So during discussing, we thought we identified some problems of interpreting actually. Then first some students then the thoughts, and after that, after discussing, we identified the interpretation. How we interpret is different among our group members also. So we conduct more interviews and clarified that problem. We thought to do more questions and clarify the problems regarding that. After that,
so now following these pre-testing interviews, did you develop any guide or anything of that sort?
Yes.
Right, okay. Now, how did you decide that at the end of 19 interviews that you have had enough? How did you decide that end point?
After each interview, we discussed among ourselves, and we get that there's no
new data in this interview. So we got that data saturation point.
Right, okay. Can you briefly tell us the way that you analyzed your data?
Madam, we did under thematic analysis. So first, after we doing the interviews, first we had the transcripts. It was done by both of our two group members. After that, it was conducted in our native language signal, and then we after the transcription, we coded them. After coding, then we categorized and verbatims identified, and then they were
Right, okay. So that's clear that you have followed the correct method. One last comment rather. Now you have found that the students consider abortions also as a contraceptive method, which is a detrimental conclusion to make. So did you do anything about it? Did you communicate these findings to someone?
Madam, after each interview, we talked with them and we gave some information regarding some correct information regarding contraceptives. Yes, madam.
Right, okay, thanks. So that's ethically also you're bound to do that. Right, thank you. Interesting.
Thank you very much, madam. Now we will be moving to the last presentation of today's symposium. So group number 30. Group members are Vijay Nayaka, WMIW, Vijay Singha, TD, Vijay Singha, WMKSP, Vijay Sundar, WMMR, Vitana, WDMR, Siad, AM. Over to you.
Good evening, everyone. Menstruation is a natural biological process that deepens our connection to our bodies and the shared experiences of womanhood. When this natural process is disrupted, it can lead to various health issues. We are going to explore one such condition today. We are Research Group 30 from 2018-19 batch, and I am honored to speak on behalf of our group at this 6th Undergraduate Research Symposium of Faculty of Medicine and Allied Sciences, Rajarattu University of Sri Lanka 2024, discussing a topic that holds a great significance in the lives of every young woman. Exploring the prevalence of premenstrual syndrome, its associated factors and impact on adolescent girls of 16 to 18 years in Anuradhapura district. Menstruation is a natural physiological process in a woman's life, making a vital part of the journey of womanhood. However, it often comes with complexities that can affect physical, emotional, and social well-being. One such condition is premenstrual syndrome, which can have a considerable impact on the lives of adolescent girls. Premenstrual syndrome is a combination of physical, emotional, and behavioral symptoms that occur cyclically before menstruation, affecting daily lives and well-being of many young girls. Our study aimed to determine the prevalence of premenstrual syndrome, its associated factors, and its impact on the lives of adolescent girls aged 16 to 18 in Anuradhapura district. We carried out this study in Anuradhapura Municipal Council area from 20th of November to 10th of December 2023. This was a descriptive quantitative cross-sectional study involving 714 adolescent girls. These girls were surveyed using a self-administered questionnaire which included tools such as Women's Health Symptoms Survey, ACOG criteria, and modified version of Premenstrual Symptom Screening Tool PSST-A. Now let's look into the results. The mean age of the participants is 17.7 years, while the majority of the participants were Sinhalese, making up to 95.8% of the sample. The results revealed that premenstrual syndrome is a considerable issue in this population, with the prevalence of 23.3%, which corresponds to 163 out of 714 girls. However, awareness of premenstrual syndrome among these young women was extremely low, with only 1.8% of the sample having any awareness of the condition before the study. This indicates a gap in education and knowledge about menstrual health. Among those who were found to have premenstrual syndrome, the most frequent reported symptom was anger, affecting nearly 99% of the girls. In addition to anger, a remarkable 95.7% of girls experienced difficulty in concentration, and around 95% of the girls experienced decreased interest in work, home, and social activities. Also, fatigue was reported by 93.8% of the girls. The impact of premenstrual syndrome on the daily lives of these adolescent girls was also considerable. We found that premenstrual syndrome impacts school or work efficiency for 94.5% of the girls, indicating a serious hindrance to their academic and professional pursuits. Additionally, 87.7% reported that their social life activities were also affected, which can lead to feelings of isolation and frustration. Furthermore, home responsibilities were reported to be impacted for 87% of the girls. Relationships with family and friends were also considerably affected. Our study also explored several factors that could contribute to the prevalence of premenstrual syndrome. Among those factors we considered, we found that lack of regular exercises, experiencing sleep disturbances, increased stress level, and consuming an unhealthy diet were also considered associated with occurrence of premenstrual syndrome. In conclusion, the prevalence of premenstrual syndrome among adolescent girls in Anuradhapura district is high. The majority of these girls reported that premenstrual syndrome impacted their personal, educational, and social lives. Despite its high prevalence and the considerable impact it has, there is a glaring lack of awareness about premenstrual syndrome among the population. As we strive towards the sustainable development goal of establishing gender equity in Sri Lanka, it is crucial that we focus on empowering young girls by addressing their menstruation-related issues like premenstrual syndrome. By increasing awareness, promoting healthy lifestyles, and providing supporting systems, we can help to reduce the burden of premenstrual syndrome and improve overall well-being of adolescent girls. We urge all stakeholders, educators, healthcare providers, policymakers, and community leaders to recognize the importance of addressing menstrual health-related issues like premenstrual syndrome. Let us work together to create an environment where young girls feel supported, understood, and equipped to manage their health challenges. By doing so, we can contribute to build a healthier, more equitable society for all. Thank you for your attention.
Now the presentation is open for the discussion.
Right. Well done, all six of you. That was a massive amount of data that you have gathered. 700 odd participants recruited, and well done. Okay. So let's get a few points clarified. How was the consent taken for your study?
Thank you for asking this question, madam. Our population is 16 to 18 age adolescent girls in Anuradhapura district. As they are under 18 of
age, we get the consent from their parents by we give a proxy consent form to their parents, including information about our research. And so the parents can get the clear idea about the research and what are the
Right. Okay. Thanks. So let's move to someone else. Can you like elaborate very quickly on how you implemented this study? Like, you've obviously used a private educational institute. How many days did you visit? How did you approach? What was it like? How did you actually do the study?
We contact the private educational institute owner and get a permission from him with a written letter. And then we first visited the class and give brief introduction about our research and gave a proxy consent form and asked them to ask students to inform their parents about our research and get a consent. And after a day or after a week, we visited again and collected the consent form. And those who gave consent, we distributed again our questionnaire in the information sheet and collected the data.
Right. Okay. Did you actually calculate a sample size?
To calculate the sample size, we used the latest research done in Sri Lanka. Prevalence was 8.75, and we applied it to the calculation of the sample size equation, estimated proportion, and took the
And you got it, no? Right. Now the questionnaire you used, is it like you seem to have taken components from different questionnaires? Yes. So did you actually validate the composite questionnaire you finally used for the Sri Lankan population? Has this already been validated?
Yes, madam. This our questionnaire has 4 components: information and history of menstrual cycle and screening tool and the associated factor. Associated screening tool we assess by using the premenstrual symptom screening tool for adolescents. And the history of menstrual cycle we take from ACOG criteria and the health symptom survey questionnaire, and associated factors based on the previous validated research studies on the premenstrual symptoms.
Right. Okay. So the time is up. Well done. And it's an interesting piece of evidence that you have gathered. So all the very best for your future research also.
Thank you very much, madam. And with that, we have now completed all 15 presentations in the evening session. Now I would like to invite Professor Nuwan Wickramasinghe to discuss the overall feedback by the expert panel. Over to you, sir.
Right. Thank you very much once again. I would like to thank all the expert panel of members who have joined with us today to evaluate our undergraduate research projects. Their findings that they have shared with us, their presentations, as well as the way that they have answered questions. We would like to get your overall feedback just to have constructive criticism for them to improve their future research. So we have 5 members today for our afternoon session. I would like to start with Dr. Damitha Gunawardena. He has been there with us in the morning session as well. Over to you, Dr. Damitha. Any additional comments that you want to share?
Actually, I think the presentations were really good, and as I mentioned in the morning, I think I'm really happy about the outcome, and I would like to thank everybody who was behind this. I think it's a real achievement, and students actually, as I emphasize in the morning, again, if you are doing any study, please focus on your methods, and then the most important part is identify and understand and acknowledge the study limitation. So that is the exercise we want. So that means you are in that study. So because there are no studies without any limitation. So every study do have limitations. So I understand it and acknowledge it. So that is what we want. And finally, based on your knowledge gained through these activities you have done during this the project, undergraduate project, please build on those skills and the knowledge you have gained, whatever the field you want to be in the future. As a medical professional, without having very good basics on research, I mean, it is really essential. So good luck to everybody, and again, I would like to thank everyone who was behind this, including the conferencing department staff and the extended staff and everyone. So thank you.
Thank you very much, Damita. And also we have Dr. Santusha Fernando. Dr. Santusha.
Yeah, I want to say that I'm really impressed with the kind of research that they're doing, and I also want to make a comment that these students, I think, with the help and the sort of sanction of your department and the ethics review committees, they are going into very important territories, and they're not afraid to explore the sort of the dark corners of our Sri Lankan society. I mean, I think I'm very impressed. They may be small scale studies, they may have some methodological limitations, maybe ethical considerations, and maybe I'm not really that bright to ask very bright questions about these wonderful research. I mean, you feel how limited you are when you see the next generation doing such wonderfully illuminating research. So I think, especially about this teenage pregnancy, even about the radiology department, whatever, I mean, these are operational, it gives such good insights, because as a hospital director, former deputy director, I know the radiology department is the most sort of controversial, hated, and they are actually under a lot of pressure, and there are lots of moral, ethical issues underlying their stress that we don't acknowledge. So I think they are going into these territories that are shedding light into our society. I'm very happy to see that. And I think always you can do better research as you grow as a professional, but I think they have tried to do honest research as well. If its sample size is small, they acknowledge it. So I like that because integrity and your honesty is not something you can suddenly grow. So I'm very happy to see these tendencies. I wish everyone at Rajarata all the best, and it feels like I'm at home because I'm with all the superstars of my faculty in ComMed. They are like the experts. So it's really nice to spend this evening. Thank you, Nuwan, and thank you, Rajarata. And thank you to your head of department as well. So well done. It's nice that my other home is doing well. It's very good to see this. It's very good.
Thank you, Dr. Santusha. Thank you very much. And also we have Dr. Asaswi Walpita. Dr. Asaswi.
Yes, thank you, Nuwan. Sorry. Yes, I should congratulate the students as well as the department, the staff behind them on the impressive work that they have done. As just mentioned by Dr. Santusha, we have seen some areas, exceptional research exploring different areas. And I think that would have motivated the other students also to step away from the comfortable zones, right? So we would like to see more research out of the Rajarata University itself. So I think some of the groups have done that and they have done really well. So I think it's a motivation for the others as well. And maybe a small bit of advice, because I know most of these research groups would not stop here. They will go ahead with presentations at other forums. So we have seen a few posters being presented today. So if we are to comment about some of the things that they could improve, of course, we have seen some really good ones, but maybe for the others, so things like, using the space in the poster efficiently, like we have seen some posters having a lot of empty space in between, and also maybe the color theme, the font size, things like that. Maybe you can improve when you go ahead and presenting this in other forums. because your work is of the standard of, you can of course go ahead and win some awards even if you attend to these little, the soft things that you can improve. So once again, thank you very much for inviting us also to, see your work, Prof. Nuwan, and also the students and also the staff, the head of the department of the community medicine department and the extended faculty. Thank you very much. Good work. Well done.
Thank you, Dr. Sastry. And also we have Dr. Dushanti Jayawardena. Dr. Dushanti.
Yes, Prof. Nuwan, thank you very much for the opportunity to comment. First, I would like to congratulate you on the excellent work done and also the students. And it's a good opportunity because otherwise students don't realize, they don't understand the importance of knowledge dissemination. So I think it's a very good opportunity that you are giving the students because that is also their prime ethical obligation. So thank you very much for the very well organized program. Congratulations to you, the head of the department, and your entire faculty and university for a job well done. Keep it up. Thank you.
Thank you very much, Dr. Shanti. And last but not least, Professor Veranja Liyanapathina. Professor Veranja.
Yeah, thank you, Nuwan, and to everyone at Rajarata ComMed. The very professional session was, I mean, it's really nice. It's good to see how it was well organized and kept to time. And the students have done a wonderful job. There was a diverse set of topics selected, diverse methods, qualitative, survey, lab-based. That's very impressive. And the presentations, the fact that they were actually given a chance to present with one slide, I think that is also very good because then they learn to summarize their work and present. Of course, there are a couple of things that the students can improve. One thing that I noted, I mean, this is in keeping with what Damita said, they were very good at explaining their results, but an element of discussion should probably be included in most of the presentations except one or two. So they can work on that for their next round of presentations. And of course, the engagement of the whole group, if that can be improved, because there's obviously one or two students who are always talking and getting engaged, but if the others can also develop confidence in this safe environment that you have provided to present, that will be really nice. So very well done to everyone involved, yourself, everyone in your department, including your head of department, and to the students. And thank you for having the non-ComMed people also involved in this. We really enjoyed this, both Champa and myself.
Thank you very much, Professor Veranja. So even though this is not the official vote of thanks, once again, I would like to extend my heartfelt gratitude to each and every one of you. I know Dr. Damita has been with us from the morning, and I know Dr. Santushya has just returned to the country, and Professor Veranja has had an examination in the morning, and both Dr. Dushanti as well as Dr. Asasi have had teaching commitments in the morning. Despite your extremely busy schedule, thank you very much for extending a helping hand to our faculty to conduct this particular event successfully. So thank you very much. Not only that, you have gone through all the 15 abstracts and you have commented on each and every abstract and you have evaluated them and you have asked very important and thought-provoking questions. Thank you very much for that. And at the end, you have provided very constructive criticism so that our junior budding researchers would learn from these positive comments that they have received, because as I mentioned earlier, this is for most of them, this is their first research that they are doing as a medical professional. So in years to come, I hope that they would take this as a stepping stone to develop their research career as well. So thank you very much. So final words before we conclude to my dear students. I think in the morning session, I mentioned this. For evaluation purposes, for each and every undergraduate research symposium, we will be selecting few best presentations, but that does not necessarily mean that other presentations are bad. There are areas for improvement, that's true, as our evaluators have mentioned, but these presentations are selected only for the evaluation purposes. So you all have to be extremely proud of the way that you have conducted your studies as well as you have presented. So this is only the stepping stone for a long career ahead. So, okay, thank you very much. Over to you, Sonali.
Thank you very much, Nuansa, and our prestigious expert panel. So we hope our undergraduates had a very productive day filled with constructive feedbacks and fruitful discussions to thrive as young researchers in the future. So to conclude the afternoon session, I invite Dr. Ayesh Hettiarachchi to deliver the vote of thanks. Over to you, sir.
Ladies and gentlemen, thank you for giving me the opportunity to propose the vote of thanks for this special event at Faculty of Medicine and Allied Sciences, Rajarattu University of Sri Lanka. On behalf of the organizing committee from the Department of Community Medicine, I would like to extend my gratitude to our expert panel of evaluators. Dr. Damitha Gunawardana, Dr. Dushanti Jayawardana, Dr. Santushya Fernando, Dr. Yasasvi Valpita, Professor Veranja Lianapathirana. Thank you for taking the time to share your expertise with us despite your busy schedules and for judging these student presentations. Next, I would like to thank Dean of Faculty of Medicine and Allied Sciences, Rajarattu University of Sri Lanka. Sir, we truly appreciate your continuous support throughout the module activities and your invaluable help in making this event a success. The true strength behind the success of these students lies in the dedication of their supervisors. So, I would like to extend my heartfelt thanks to all academic staff members of Faculty of Medicine and Allied Sciences, Rajarattu University of Sri Lanka, who guided these student groups and contributed in numerous ways to success of this event. I must also thank the extended faculty of the Faculty of Medicine and Allied Sciences. A special thanks goes to Senior Assistant Registrar and all the non-academic staff members of Faculty of Medicine and Allied Sciences. My sincere thanks to Mrs. Achini Irukal Bandara and her team for their excellent support with the IT aspect of the symposium. A heartfelt thanks goes to Professor Sunet Agampodi and Professor Tilini Agampodi for being our pillars of guidance. I would also like to extend many thanks to Professor Nuwan Wickramasinghe and Dr. Janith Warnasekara for their deep commitment to successfully completion of this Research in Medicine module. A very special thanks goes to temporary lecturers and other academic staff support members of Department of Community Medicine, Dr. Sahan, Dr. Prasadika, Ms. Manojika, Dr. Ravinya, Dr. Jalia, Dr. Hirunika, Dr. Pasindu, Dr. Ishan, Ms. Sonali, Mr. Dilan, Mr. Kavinda and Ms. Krishanti for their hard work in organizing all the logistics of this event. Dear students, on behalf of the organizing committee and the Department of Community Medicine, I thank you for your active participation. We wish you all the best in your future endeavors, and we hope that even though you completed this Research in Medicine module, you will continue to engage in research. Thank you very much and have a wonderful day.
Thank you, sir. And thank you, everyone. So, dear panel of experts, now we will be taking few moments to finalize the students' marks to select the best presentations of the both sessions today. So, please feel free to leave the session because we know that you are with the heavy and busy schedules. But dear 2018-19 batch, please stay with us to know the winners. Thank you so much. Have a nice evening.
Okay, good. Okay. Something. Okay. Dear students, okay, dear students, we are going to announce the winners. Of course, there are 30 groups who did really well. Of course, even though we announce the places, of course, I need to mention that the difference between the total marks are different in decimals. So I hope that you all are winners. But in tradition, I'm going to announce the winners of the first session and then second session. And finally, I'm going to announce the overall winner today. So first of all, I congratulate all the presenters as well as winners. And please do not stop your research career from here. Okay. So the first, I'm going to announce the third place of the morning session. Third place goes to incidence of transfusion transmitted hepatitis C infection among beta thalassemia patients registered in Anuradhapura Thalassemia Center, presented by Dharmaratna Gunawardhana Disoisa, Devendra Devmini, and Dharmasena. Congratulations for the third place winners of the morning session. Second place. Second place goes to knowledge, attitudes, and concerns on childhood immunization in post-COVID era among Sinhala-speaking mothers in Anuradhapura, Sri Lanka. A qualitative study presented by Bambarendra Bandara, Bandara BM, Bandara RM, Bandara RM, and Bandara WM. Congratulations for the second place winners. First place of the morning session, that goes to antioxidants capacity and total phenolic content of selected beverages and their acute effects on serum antioxidant capacity, presented by Darshika G.L., Chandrasiri G., Chaturangi B., Dasanayaka I., Dayakanta J., and Dayaratna P. Congratulations for the first place winners of the morning session. Next, let's move on to the afternoon session. First, the third place of the afternoon session, that goes to burnout among radiographers and doctors in radiology units of 5 selected hospitals in Sri Lanka, presented by Pereira, Nimeshika, Nusha, Pallepola, Patirage, and Patiraja. Congratulations for the third place winners of the afternoon session. The second place of the afternoon session, that goes to awareness and attitudes regarding first aid after a snake bite and knowledge regarding identification of venomous snakes in Sri Lanka among farmers in Nuwaragampalata Central Divisional Secretariat Division, Anuradhapura. Presented by Seneviratna, Sevandi, Silva M, Srivardhana S, and Suravira S. Ladies and gentlemen, the winners of the afternoon session, that goes to resilience at work. It correlates and relationship between resilience and work engagement among government school teachers in the Nuwaragampalata East Education Division, presented by Sandanayaka K, Samarasingha G, Samaratunga S, Sampath J, Sandamini P, and Sandeep GT. Congratulations for the winners of the afternoon session. Ladies and gentlemen, the winners or the overall winners of 6th undergraduate research symposium of Faculty of Medicine and Allied Sciences, Rajaratnam University of Sri Lanka. The first place, the overall best poster presentation today, that goes to knowledge and prevalence of self-medication with analgesics among undergraduates of Rajaratnam University of Sri Lanka. Presented by Sendanayaka D, Sarambage P, Senadida K, Senanayaka H, Senanayaka M, Seneviratna D. So congratulations for the winners of the 6th Undergraduate Research Symposium of Faculty of Medicine and Allied Sciences 2024. So congratulations for all the winners. And I congratulate all the presenters. As I mentioned from the beginning, the difference between the total marks were in decimals. So congratulations. So that is the end of the 6th Undergraduate Research Symposium. Once again, we thank everybody who supported for the success of the research process as well as the 6th Undergraduate Research Symposium. Special thanks should go to the students who conducted very important research targeting different disciplines of medicine. So congratulations, and we mark the end of the 6th Undergraduate Research Symposium. We will meet again with the 7th Undergraduate Research Symposium. Thank you very much and have a good day.
Thank you very much, sir. And also we congratulate all the undergraduates who presented today. Have a nice day. Thank you.
Recording stopped.